The CLCDN stands for the Clinical Leadership Collaborative for Diversity in Nursing, a partnership between MGB and UMass Boston. Back in 2007, the Chief Nursing Council, and it's a council that has all the chief nursing officers from across the system, they had done an analysis really looking at the nursing workforce and looking at the diversity of the nursing workforce. It was very clear the system needed to be proactive about really diversifying the workforce and what we needed to do.
The partnership between UMass Boston College of Nursing and Health Sciences and MGB really is a win-win situation. MGB is trying to diversify their nursing workforce, and UMass Boston is one of the most diverse campuses in the New England area. We have 45% of our students who identify to be of diverse backgrounds. It was just this beautiful partnership that we came together to try to diversify the nursing workforce by creating opportunities for the nursing students. Patients get into the hospital system, they look around, and if they don't see somebody who looks like them, the first impression is they may not understand what I'm going through, or they may not understand what I can and cannot do. A lot of times that creates distrust between the patient and the healthcare system, and the nurses are representing the healthcare system. They're there by the bedside, and when patients trust their nurses, they're gonna then listen to what they have to say, comply with the healthcare education they're provided. They're gonna want to take care of themselves.
I grew up in Haiti, and I came to the US when I was 10 years old. I did not speak English when I got here. I've had to overcome this language barrier. What spoke to me about the CLCDN mission was the fact that it wanted to increase how we saw diversity in the nursing field to allow patients to have somebody they could relate to. That mission really spoke to me as an immigrant.
There are opportunities where these students don't see anyone that looks and sounds like them in leadership roles or in practicing nursing positions. As an African American nurse, when I was in nursing school, I was the only one in my class. I never had a faculty member of color until I was in my PhD program. So I never saw anyone that looked like me.
Whether you're 6'3", 250 pounds, you'll find that there is a place for you in these fields.
A lot of our students are first in their families to go to college. They may not have had that mentorship of how to navigate college life, but they got that through their mentors.
The outcomes matter, and every single student that we've had in this program has not only graduated, they've passed their boards, and they are practicing as nurses.
It's important to understand that if it wasn't for the program, I don't think I would just walk up to Mass General and apply for a job. I needed to trust people. I need to feel like the place would welcome me for who I am. And programs like the CLCDN facilitate that path, facilitates that journey. I start receiving the help from the CLCDN, and now 12 years later, I'm actually paying back, right? I'm donating my time, I'm participating in the program, and I'm helping others by being a mentor for the program. I felt like if I didn't have that safety net, I wouldn't be here. So why not be somebody else's safety net this time?
The program has multiple components, including scholarship support. We assign them mentors to help guide them not only when they are students, but also in their first year after graduation. We do professional development and leadership development activities, support for the NCLEX exam to become a registered nurse, and preferential clinical placements within the MGB system. Because not only do we want them to learn our culture, we want them post-graduation to become one of our nurse colleagues.
There's just so much value in this program, and having the partnership between the university and the hospital really just brings the two together, because you have to set a very solid foundation. If you wait until an organization or someone's career is formed, it's much more difficult to bring about change.
I want to get into the healthcare system and have somebody who looks like me. I want to be able to feel like, people are going to understand where I come from, what I'm going through, what I would like to have, without having to sit there and explain my cultural values and norms.
Nurses are the most trusted profession, but we're not always the most influential profession. So I want to see these diverse nurses in leadership roles. I want to see them becoming directors. I want to see them becoming the chief nurse of a hospital or of a system. I want to see them in leadership roles from at the bedside all the way to the C-suite, because it's really their voices that are going to have an impact to influence change, ensuring that all voices come and are part of the table in the decision making.